Hi, my name is Lana Tran, and I am one of the business partners in this business proposal for the Azusa Regional Medical Center Outpatient Clinic. A little bit of a history in the background of how we came up with this clinic and the reasons behind it. Azusa Regional Medical Center has been treating a high percentage of patients with type 2 diabetes in the inpatient setting. They have an average length of stay of 5.8 days. The most common demographics of this population are patients who are 50 years old, male, overweight, have a family history of type 2 diabetes, and their hemoglobin A1C is greater than 9. These patients are frequently admitted due to poor blood sugar control in addition to non-healing skin ulcers. This population of patients are admitted anywhere in the hospital that has a bed. Azusa Regional Medical Center has 2 wound ostomy nurses. One of these nurses is a certified nurse practitioner. Both of these nurses evaluate this population of patients for a consult. The average daily census for this group of patients is about 31. 12 to 15 of these patients need the wound care nurse to evaluate and treat them. The wound care nurse has a time frame of 24 to 48 hours to see these patients. The wound care nurse will then provide an evaluation and a treatment plan where they make the recommendations for the type of wound care needed. The medical team, such as the bedside nurse, are the ones who carry out the wound care orders and wound care itself. In reviewing data from the previous fiscal year, the average daily census of the type 2 diabetes patient was at 24 and had grown to 31. The readmission rates within 30 days of discharge in this population has also increased from 11% to 18%. The patient satisfaction score for the question, "I feel prepared to care for myself at home," had also been lowered from 80% to 50%. The results from this data had senior leadership at Azusa Regional Medical Center to come up with putting together the hospital-based outpatient wound care clinic for this population. With the increasing census at Azusa Regional Medical Center, it has posed an issue of the wound care nurses being able to serve this population when they are admitted into the hospital. The outpatient wound clinic would be able to offload the staffing issue at Azusa Regional Medical Center. For the patients who are admitted at Azusa Regional Medical Center and needs to be evaluated by the wound care nurse, these patients could be reviewed by the attending doctor and confirm if these patients are stable enough to be discharged home from the hospital. They will be given an urgent referral to the outpatient wound clinic within the same week. By referring these patients urgently and also obtaining an appointment for the patients prior to them leaving the hospital, this would help with the high number of referrals the wound care nurses need to see on a daily basis. The case managers in the hospital would obtain approvals for these patients for the referral to the outpatient wound clinic.